Hey, everybody. We're going to take just a few minutes to get folks settled in the room. We're here at noon. So as people are coming in, I want to welcome everyone to the last public service perspectives of the year. Tongue twister. My name is Rebecca Korneski Woods, and I am the new event coordinator for the Voinovich School. Mackenzie has been passing the baton to me very graciously. And I have just a few housekeeping things here to start. First off, if you are in Zoom, welcome. If you have questions throughout the session, feel free to put those in the chat. And I'll be collecting those so that we can ask them of our speaker towards the end of the session. Additionally, this session is being recorded as all of our other sessions have been, and it will be available on the Voinovich School website in a few weeks. So be on the lookout. We'll send an announcement when we get those all put up. And so with that, I would like to pass it off to Jeff DeBelco.
Greetings, everyone. Jeff DeBelco, a professor here at the Voinovich School. And I gotta say a word of how we got to today. I recently started working on aging in Ohio. And so literally like search number one, day number one, aging in Ohio, there was this Center for Community Solutions and this guy, John, who was regularly contributing to the political processes, to the research that informs our understanding of older adults in Ohio. And so I started subscribing to his five things you should know this week newsletter, and just kept learning from this guy. Started following on social media and noticed that he identified as a Bobcat alum. And so it was that prompt that said, hey, we have to get John Corlett on campus so we can learn from his experience, 10 years running this over 100-year-old research and advocacy organization based in Cleveland and Columbus. Then discovered also former state leadership roles, including the Office of Medicaid here in the state of Ohio, running advocacy campaigns that he knew in some ways he was going to do right away, talking to John in terms of studying campaigns while an undergraduate in political science at Ohio University. And so it's a real thrill to welcome him to come share some insights from a very distinguished career in government, out of government, in advocacy roles and advisory roles, including the Office of Sherrod Brown and other folks who are real leaders in the state. And so we look forward to him sharing insights from a career that spanned work on women, families, LGBTQ, older adults, and persons with disabilities. Before we turn the floor over to John, I'd just like to introduce Dean Tracy Flauk, who's joining us on screen and online for a few comments from a fellow state government leader traveler. So, Tracy.
Good afternoon, everyone, and I'm so pleased that you've turned out today for our presentation. We are very excited to host John Corlett today. I've personally known John for about 20 years and can attest firsthand that he's an amazing advocate, a policy expert, and an all-around great guy, really a thought leader in so many areas of health and human services. He's also passionate about responsible public service and effective public service. And we agreed he would be a fantastic speaker for our school and everyone in the Voinovich Schools network. John also never takes himself too seriously. And as proof of this, I pulled up a photo of us from 2012. John at the time was the vice president of Metro Health Medical Center in Cleveland, which is the largest public hospital in the state of Ohio, and last I knew, the largest Medicaid provider for the state of Ohio. And I was serving as mental health director at the time for the state, and we were conveying a hospital that we had closed, a state psychiatric hospital, over to Metro Health because we shared a campus up on West 25th Street in Cleveland, and Metro Health wanted to take the property and reinvent their campus. And we came across a land conveyance, I think it was from 1946, that had covenants on it that required that a financial transaction had to occur in order for the land to actually, be conveyed. And so John brought a check down to the state, and here we are exchanging. I think this was actually your personal check, which is probably a problem. But we photographed the moment and thought that it was a terrific piece of bureaucracy. So with that, I want to turn it over to John, but I'm truly excited to have you at the school today and to look forward to your presentation. Thank you.
It's been really, I've enjoyed knowing Tracy. I got to know her probably best. She was I was Medicaid director for 2 years with Governor Strickland. She had been Medicaid director right before me with Governor Taft. And so I knew her from that. And then she worked at the state budget office during that period of time. So obviously, the month I became Medicaid director was the year the Great Recession started, and my last month was the month it stopped. So I spent a lot of time in the budget office because we didn't have any money, and we were trying to hold things together. So it's really great to be here, Tracy. So I'm just gonna I also want to acknowledge Rose Freck, who was one of my colleagues at the Center for Community Solutions. At one time, we had 4 Bobcats in the office. Now there are none. We've all left to do other things. So we have got to work on them to make sure we get more Ohio University folks back into Community Solutions. So.
Sure, we got it over here. Yeah. As always, when the things start happening, gotta get my mouse. Oh, there you go. Thank you, everyone, for your patience.
So I always tell everybody that OU was the foundation for. If there's anything good I have done in my life, it all started for me here at Ohio University. And when I was an undergraduate here, I was very involved as a volunteer with Planned Parenthood. It used to be a Planned Parenthood in Southeast Ohio. They were right on Court Street. What was then called the Lavelle Building. I don't know if it's still called that or if it's called something else. And I think it's still standing, since Court Street does seem to have perennial fires on it that sort of changed the landscape, so to speak. But and so my career aspiration was to work for Planned Parenthood, which is where I started working in undergraduate. Volunteer, and I worked there for a few months. I started doing Planned Parenthood related work in Columbus and in Akron. But I started as a journalism major, and I was telling someone this story the other day that I went to my first journalism class, and the professor said that if you spelled a name wrong in a story or whatever that you turned in, that you would get an F. I'm like, oh, that's not for me. I cannot spell. I'm a horrible speller. This is before computers, so it was all out of typewriter. Erasable paper was just a thing then, so which was my friend. But so I really got involved here. This is where I learned, first did community organizing, first did political organizing. I took, at that point, I don't know if they still offer this, you could take a whole quarter off and you would get 18 credit hours to work on a campaign. So I worked for a state rep campaign where I lived back in Menor, where I was from. And that was a great experience for me because I had never seen that side of it before so intimately. And when you work on a state rep campaign, it's not like there are 5,000 staff. It's usually you and maybe 1 or 2 other people who are doing it full time. And so it was a great experience. And it was during that experience that I saw my first demonstration of political power. So the person campaign I was working on, his name was Eddie Hughes. He was not real tight with the then speaker, Vern Wright. He was sort of viewed as kind of a renegade in the Ohio House. And but eventually he made peace with the speaker. And the way I knew he made peace with the speaker was when I started then to go to the post office to pick up checks. A lot more checks started coming from all the interest groups, the PACs and stuff like that. They all started supporting the campaign because they made peace. So that was like an early lesson to see the power of individuals and the power of politics and campaigns and stuff. But I did lots of independent studies, lots of political work here. My major professor at that time was Patty Richards, and she was really my campaigns and elections. That was sort of where I stayed focused. But I spent all my time, United Campus Ministry, Gay People's Alliance, Bentley Hall I spent a lot of time in, taking classes there, and then what was then the Baker Student Center. Because I was also, when I was here, I was the president of the Athens Consumer Protection Association. which was sort of like this little ad hoc group that did like consumer rights things and stuff like that. I don't think we were particularly effective, but I did have an office at Baker Center. I know it's kind of cool. But and then also, we were the Gay People's Alliance then, and it took until my senior year that we finally persuaded the group to be the gay and lesbian and gay people's alliance, because all the guys I was with, they didn't really want to include lesbians. So everyone's like, okay, covers everybody. So we still have those debates now about language and what we're called and what people are calling. But I've always thought you should call people what they want to be called. So let's go here. So here I am. So that's a picture of me with Dick Celeste. I was then, at the time, I was working for NARAL, Ohio. I did abortion rights organizing in Ohio. I traveled all over the state. We had chapters all over the state that kind of did that kind of work. But this was the day that he signed the executive order, the first executive order the state ever had, saying no discrimination based on sexual orientation. So it's the first time that a governor had done that. And as you can see, I'm trying to look taller. And I also only owned one suit, a tan suit. I don't know why when I ordered, my only one suit was a tan suit, but that's what I ordered. Oh, because when I was here my freshman year, I got invited to go to the White House, Jimmy Carter was president, because I'd worked on his campaign to do, it was around the time they were giving up the Panama Canal. And so they were having all these events to bring people in to help sell the Panama Canal Treaty Congress. So I bought a tan suit for that too. Again, why a tan suit? I don't know. But my first job was in Planned Parenthood. And when I started, I was the fundraiser. That was sort of the word for it. Later on, I would transition to development director. And I think now it's probably advancement director, or, the title has changed over time. But I think one of the things I learned from that first experience that I've sort of always kept with me is that understanding where the money comes from and where it goes is really important in any organization. And because at the time, it was, if an organization would start, they'd have a director and a developer. Like, they knew they needed money and they needed to raise money. And so also four of my first 5 bosses were women, which was really, it's probably still unusual. It was really unusual back then. But I think for me, that made me a much better leader and a much better supervisor and boss, because I learned a lot from them and saw the challenges that they faced. So that was sort of one of the learnings I've sort of taken away. The other thing that I was really fortunate, during that initial time was that they invested a lot in training, particularly around politics, fundraising, communications, and that was not so that was good. And I don't know if that was because it was primarily a women-led organization, if that training and education was more prevalent, or if that would have been anywhere. But that was really important to me as a young person to be exposed to other people. And then I would do a lot of training, and as I spent more time there, then I was the person training others. The other thing about it was that it's also really personal work. Like it was a personal thing that I cared a lot about as a person. And it was also kind of isolating because, I couldn't tell anybody that worked at Planned Parenthood and not hear what their opinion of that was. Like it was sort of like everybody felt free to share that with me. And that's where I first started this notion of what I've sort of thought of through my career is this sort of balancing the pragmatic with the prophetic. And what I mean by that is, I'm very much a pragmatist. Like I come from the school, like, okay, if I can't get everything, can I get something? Can I at least put down a marker for some sort of improvement or some sort of legislation? Maybe I can't get all the funding, but can I get half of the funding? Because my attitude was, I live to fight another day. I'll be back again, and I'll go at it again and try and get more and try and get more of what I wanted. But sometimes there's things where you feel like you have to speak out. Like you may speak out sometimes, and at least I would think that it's not going to make any difference. That the powers that be are going to do what they're going to do, and no matter what I say. But it felt like sometimes you had to bear witness, like you just had to say, we know that that this isn't, that we're not going to sort of change anything. We feel like we need to go on record and say something about whatever it is. And I've had those sort of moments throughout my career, and sometimes where I've chosen not to be prophetic because I'm so focused on what my pragmatic goal is that I don't want to endanger that. But there's other times where it's just like, okay, we have to speak out. He got his May. So anyways, so I spent the first 15 years of my career doing this Planned Parenthood related work. So I worked in Athens, Columbus, Akron, and I finally made it back to which is where I grew up. So there's Governor Voinovich at the time. So in 1996, I joined a group in Cleveland called the Centers for Families and Children, which is kind of a multi-service health and human service organization. And the interesting thing is, I then joined what was called the Federation for Community Planning after this, but they were really the result of a project led by the organization I just worked at to sort of bring together 5 different agencies in one comprehensive organization. But it was really that really marked my first real engagement with broader state policy. Before that, I've sort of done repro rights, and was pretty much regularly on the losing side of those issues in Ohio. The one thing I always like to point out to people now, particularly younger folks, back when I was at Planned Parenthood, almost all the anti-abortion legislation came from Democrats. In Cincinnati, Columbus, Cleveland, the politics were different then because a lot of them were sort of old school men, sort of these sort of ethnic Catholic Democrats and stuff. And when I first started Planned Parenthood, it wasn't that long after the court decision that sort of I was doing this work. So that whole issue is sort of still, as it is today, a very hot issue. So this was the first time I got to work on broader issues, and I have to say at first it was really boring. I'm like, there's no intensity here. Like, you're gonna be picketers, there's no one calling in death threats or threatening to shoot us and stuff like that. And so it was just it was kind of weird being in a different environment. But that's where I first started my state work, and so worked a lot. George Bush was governor then. That's when I worked on my first state budget. It's when I engaged in state coalition work. There was a group here, started by in Columbus, started by Rose's father, Jack Breck, called Have a Heart Ohio, which is a statewide health and human services coalition. And the name came from the fact that when Governor Celeste was governor, and the slogan has just been brought back, they created the slogan "Have a Heart Ohio," which kind of tourism. Ohio, the heart, as a tourism slogan. And so Jack and some others took that and turned it around and said, "Have a Heart Ohio," raise welfare benefits, the level of welfare benefits for people in the state of Ohio. And so I got really involved with that state group. I think initially I spent most of my time listening. I like to think that I'm a person who kind of listens first before I talk. Maybe that came from working for women at the beginning of my career. But I tended to sort of listen first, but I learned so much from people. And a lot of people sort of took me under their wing, sort of taught me a lot about state government. So one of the things where I got to be a little both prophetic and pragmatic was I worked on, this was shortly, when I was there, was shortly after the Ryan White Act had passed. And the Ryan White Act included funding for HIV drugs. And so Ohio needed to appropriate money in order to draw down all these federal funds. And so, not exactly the most popular issue in Columbus, but I sort of worked on the grassroots side. And this was the first time I heard the phrase or sort of saw the phrase in action. Sort of they call that strange bedfellows in politics, where you pull together interests that you wouldn't think would be aligned together. And so who would you pull together if you're trying to get funding for HIV drugs? Drug companies. Who's going to make money from this? The drug companies. Where is this money going to go? To the drug companies. But they needed some human touch to it. And so we organized individuals that were more impacted. But the piece that I was really, that I thought really helped a lot was I worked through one of my board members at the Center for Families and Children to get a letter of endorsement from the Bishop of Cleveland, Bishop Hilla. So he wrote a letter to a policymaker saying, I endorse the funding for this HIV drug assistance program. And so then we shopped that around to every office to sort of say, okay, look, you've got all the right people on the right side of this. And so we got $7 million that first time, and that amount has grown over time. It's a pretty substantial program still. And the other thing I did in that job was I ran my first Cuyahoga County Health and Human Service levy campaign. And for me, doing that was kind of, example of taking risk. And this risk that I took, I didn't really appreciate that it was a risk. And because I was asked first by the county administrator to do the campaign. I said, no, I'll do that. It's 90 days. It's 90 days away. That's crazy. Then the county commissioner asked me, like, okay, I'll do it. So I go meet with their pollster. He goes, this could lose. I'm like, what? Lose? You can't lose. It's never lost. I don't want to be the person who this loses under. And so in 90 days, we organized 450 volunteers. We raised maybe $500,000 or whatever to fund the campaign. Because this was also the first campaign, which I also didn't understand when I took it on. Prior to that, the county employees actually helped run the campaign while they were on county time. That became illegal. There was an attorney general opinion that you couldn't do that. So I had to get all these people in the community kind of take on roles that county employees had done previously. So it was but we won. And the most important thing that came out of that for me, other than winning the campaign and the programs that it supported, was it really changed the way a lot of people viewed me in county government. They saw me kind of as their partner, whereas before I was, maybe I was just one of the spenders, so we used to call them, the folks who just want to spend money. But I was sort of more of a partner with them, and it really changed my relationships I still have to this day with some folks who are still in county government. But that was, again, so that pragmatic prophetic kind of played itself out, I thought, in that HIV drug fight. So in 1999, I joined what was then called the Federation for Community Planning. I actually don't think I started as a senior fellow. I think I came later. I was a director of public policy. And at first point, I was just a director of myself, basically. There wasn't anybody else. But over time, we built a 8-member multidisciplinary policy and advocacy team. So we worked on Medicaid, tax policy, on early learning, federal policy. And when I left, we were basically raising $1 million a year to fund that team, and we did work all over the state. That's where I sort of got my experience with Medicaid. That would sort of lead to my next challenge after this, and it was that I took over the leadership. I took over the chairmanship of Have a Heart, Ohio. The other thing that I worked on while I was there was there was I think it was state treasurer. I don't know if you say, Ken Blackwell was trying to amend the Constitution to put in place what they called a taxpayer's bill of rights, which would have limited growth in local and state government to the rate of inflation. Which the only place that had done that was Colorado, and what it does over time is kind of shrinks. And that was the goal, just to shrink government. Grover Norquist, the guy who came up with the idea, his famous quote was, "I want to shrink government to the size that I can strangle it in the bathtub." That was sort of his motivation. So I got to work on that campaign, and what was really great about working on that and leading it was I then got exposed to a lot more different groups than I had met before. I remember the first time I went to speak statewide Township Trustee Association. I had no idea there were like 800 townships in the state. But when I went there, I met all of them, and they were pissed. We're going to make their lives more difficult. So got to do that, and then I did a fellowship office in the DC offices of then Congressman Sherrod Brown. This is back when it was kind of pretty cheap to fly. So I fly to Washington every Tuesday, fly home on Friday. I stayed in my brother's basement in DC on the little pull-out couch. But it was a great experience. Sherrod Brown, great guy. But it was also I just learned a lot about how a congressional office operated. And a lot of these things I've done along the line, it's just like more learning that kind of goes in. You're always learning, how does a congressional office work? What are the things that matter to them? But I only did it for like 4 months. That was plenty of time to do it. And I did it while I worked at the Federation. It sort of freed up my time. I was saying I think it said last night, I still have my ID badge from that, which is supposed to turn in. Somehow was able to get that through the rules or whatever. Also, that's when I sort of served as an unofficial advisor to Ted Strickland's Movement Growth. So we were sort of their health and human service, particularly Medicaid sort of policy sort of experts. And so we'd help them sort of with positions and answer questions and stuff like that. And so after he was elected, I was asked to chair his health care transition team, which was sort of like herding cats. It was like every interest group related to health sitting around the table and all telling us what they wanted the governor to do. And I'll never forget the day after he was sworn in, we met with him to kind of go over this stuff. And it's like, we're like maybe 10% of the way through, and I'm like, oh, damn. Governor Strickland served on the Energy and Commerce Committee in Congress. He knows more about these issues than most people I know. So he's like asking all these questions, like, oh, I gotta get better organized. He knows a lot. He was always so impressive. I always say he was the lowest maintenance politician I've ever met. The kindest, nicest person, and just a great guy to work with. But at the time, I didn't want to move to Columbus. I really loved Cleveland. So I like turned down like coming into the administration. Just said, I'll help from the outside and help. And we worked sort of to support a bunch of things that were in his first budget. And I think that first budget passed with only one dissenting vote in the legislature. It was a woman from Western Ohio. So that's there, and then. So then I get and there's the current Medicaid director posed next to me when I became Medicaid director back in December of 2007. And that's my picture with Governor Strickland. I invited him to my agency to come meet people. I don't know that anybody had done that before. And so he came over and walked around and met staff and stuff like that. One of the best pieces of advice I got when I was at Medicaid was from my executive assistant. She goes, you should go around and introduce yourself to all the employees. And so I literally went and met every single person in the agency. Went up to their desk, shook their hands, said, my name is John Corlett. I wouldn't let people call me director or Mr. Corlett. They had to call me John. And almost everybody was able to do that. But there were some that were never able to sort of get that word John out of their mouth. It was always director or Mr. But it was, as I said before, it was the month the Great Recession began. And that really did shape my entire tenure there, because the one thing I'm really proud of during that period of time, we never reduced eligibility. And that was made in part by some federal aid that came along, but that we kept eligibility as it was. It was also a time when state government control was split between Democrats and Republicans. So when I first got there, it was a Democratic governor and a Republican Senate, and a Republican House. The second year I was there, Democratic governor, Democratic House, Republican Senate. And that's kind of like the makeup I kind of prefer. I like having it split because I just think you get better policy that way. Because I've always felt that neither party, any group has they're not the only ones with good ideas. Good ideas come from everybody. And so it was a good effort. And the other thing I should say, when I left, I got thank you letters from two members of the legislature. One was Bill Batchelder, who was a Republican minority leader of the House. The other was Republican then State Senator Bill Seitz from Cincinnati. Neither one blaming liberals, but they both, I still have those letters, wrote me thanking me for my work and running the Medicaid program. But the thing that was really good about that, I was there for 22 months. The lifespan then of a Medicaid director was 24 months. So I always say I was slightly below average in terms of the time of my tenure, but I really want to go back. I got to do two things that were really great learning. One was I got to implement a budget. So I had to take the budget that had been passed by the legislature and signed by the governor and implement it. Which is no small feat. I learned in that job the importance of IT. We could not do anything without IT. And so I don't think I fully appreciated that when I was out in the outside being that advocate, like, oh, you should do this, do that. But then you have to make it happen. And then the other piece was I got to pass a budget through the legislature. I didn't pass it myself, but I was the person sort of in charge of getting that Medicaid, the governor's Medicaid budget through the General Assembly. And so that was a good experience too. Spent a lot more time in the legislature. I'd be Medicaid offices were in the Lazarus building. They still are in the old Lazarus office. And so I'd always be walking over to the right building, going up to the floors of the legislators and talking with them a lot. That was also the first time I did one of those sort of marathon testimonies, where I was up in front of the committee for like 3 hours. And that was sort of like, by hour 3, I was sort of like, where am I? Like, when will this soon be over? Will this soon be over? In fact, I had a bet then with the director of the Office of Budget Management about who would have the longer testimony. She beat me. She had a longer testimony, so I had to take her out to dinner. But yeah, it was a really good experience. Like I said, Ted Strickland, a really great guy to work for, and really had the right motivations. And Maureen's now the Medicaid director for the state of Ohio, and she's doing, I think, a fantastic job. So then was really joining Metro Health, and so when I left Medicaid, I got 2 calls on the day it was announced. One was from the president of Metro Health saying he'd like me to work here, and the other was from a consulting firm doing Medicaid consulting around the country. And first thing I said to both of them, I'm forbidden from having these kind of conversations until I'm out of state government, because all the ethics rules. So call me in a month and we can talk then. But I decided I really wanted to. I missed Cleveland, so I didn't want to be flying all over the country. I wanted to stay in Cleveland and work with Cleveland. Metro Health is an extraordinary place. I'm on the board of directors now, but it's a large public hospital, as Tracy mentioned before, the largest single Medicaid provider in the state of Ohio. And we're now, I think, 180. My husband, Doug Van Auken, who's sitting back here, was also a physician there. But we'll talk more about him later. But anyways, so here again, this was a great project that we got to do. I was at a conference in Washington, D.C. of public hospitals, and they were talking about in California, they had done this thing where they had expanded Medicaid early before the federal expansion by using a provision in the Affordable Care Act to do that. And I turned to my colleague who's there with me, Tamika, and I said, we could do that at Metro. We could expand early, because at the time we were doing like $200 million worth of charity care because we had so many uninsured patients, and we were just drowning in this uncompensated care. So we started thinking about it, and we said, yeah, we can do that. So my first person I said it to sort of publicly outside the hospital was Greg Moody, who was coming in as Governor Kasich's. He was going to lead this Office of Healthcare Transformation. I knew Greg from his time in the TAP administration, back to those early jobs, and that's what I was going to tell. And so he said, oh, that's really interesting, because he'd actually tried to do something a little similar that was more difficult before the Affordable Care Act. So, and then I met with the new Medicaid director, John McCarthy, I think on his first or second day in office. We ended up having breakfast. I can't remember who else was there. Another Medicaid person and we had breakfast with him. And so I raised it with him then, and he was less familiar with it. But he eventually, and Greg, to their credit. So here I am, I'm in a Metro Health Hospital in Cleveland, Democratic city, Democratic county, going to a Republican governor saying, and they haven't made their decision yet about whether they're going to expand Medicaid or not. So I'm going to say, we want to do this in Cuyahoga County in Cleveland. And they said yes. But them saying yes and us getting to actually getting it done was really challenging. We had to do 2 things that the state would normally have done, but they couldn't do in such a short period of time because we didn't have a lot of time. We had felt an urgency to get this up and running so we could get coverage. And so one was, well, you have to have an eligibility system. You have to be able to determine whether people are eligible, and you can't just be eligible for your program. You have to screen them for regular Medicaid. So the wizards at Metro Health built an eligibility system within like 2 weeks. And we were able to demonstrate that we could screen people for regular Medicaid or for this new, what we call Metro Health Care Plus. And then the next thing they said was, well, how are you going to pay claims? I mean, Metro Health was not an insurance company. We never paid claims because we weren't just paying ourselves. We also had, one of the requirements was that we partner with an FQHC, a very qualified health center. So we picked 2 FQHCs to partner with. So Medical Mutual built it for us. They built a claims payment system. They were interested in learning more about Medicaid. So they did it for free. We had 2 bids, $2 million and free. And so we were, they've always been good partners to Metro Health. So they built that. And then I had to go to Washington, D.C. And so that's me outside of the executive office building, looking very stiff. But Mark Moran on this side of me was the president of the hospital, and Jim Mizek, who was a family physician at Metro, and really one of the policy physician leads at Metro, went with us as well. So we had to tell them what we wanted to do. So it moves along through CMS. They're like getting ready to sign off on it. And then almost at the very last, right before it's ready to, and remember, this is during election. This is the presidential election. So that's also going on. And the Affordable Care Act wasn't exactly the most popular thing with everybody. And so almost right as we're ready to get the approval, to press the button to say yes or whatever, I get a call from the state saying, we need to delay this for a month because we don't want to indicate which way the governor is going to go on Medicaid expansion. I'm like, oh no, I had to tell my boss that, and they were like, everybody was sort of going crazy about that. Well, do we need to drive down to Columbus? Like, no. We're trying to manage this. Well, so I did one thing. I don't know if I've ever told, and this was Greg when I was talking. I don't know if I ever told this, but I know I'm on tape. So I knew someone at CMS that I had worked with in a previous role that was in charge of waivers for CMS. So I called her up. I said, this is what they've said to me. Have they said the same thing to you? She goes, yes. Okay, I trust them. And so a month later, they gave the okay, it got approved. And on day one, we enrolled over 30,000 of our uninsured patients in Medicaid a year before the expansion happened in Ohio. And it was a pretty emotional moment because, as I would hear, some of those patients had never had health insurance. They never had health insurance as kids or anything. And so and we saw the effect almost instantly in 2 places. One was in our pharmacy, because a lot of our uninsured patients had never been able to fill those scripts because they couldn't afford to do it. In fact, I always tell the story that when I was there when Metro instituted e-prescribing, we were a really early adopter in a lot of this related work. So when we implemented e-prescribing, it was the first time that we saw that 1/3 of our scripts were never finished. When they were on paper, there was no way to sort of pull all that data together. So that's where we saw the demand grow in pharmacy and in behavioral health. That was the other place. We couldn't meet the behavioral health demand, so we had to expand our set of partners who worked in that space for those 2 areas. But and the other thing so this is more of the prophetic work, so when I got to Metro Health, people had been trying for years to get domestic partners. And we had a really bad prosecutor's opinion that said we couldn't do it. Our county prosecutor had issued a legal opinion. So then that prosecutor was defeated at one point. And so I knew someone who was working for the new prosecutor. I actually ran into them at a bar and said, hey, can I come talk to you about this? We really, think, maybe benefit from a new look, a new prosecutor making a new look. And so I worked with our legal department at Metro, and we got a new legal opinion. And this is before the Supreme Court decision that legalized gay marriage. But we got a new legal opinion that allowed us to offer domestic partners. And that felt really cool to me because I knew there were a lot of people who worked at the hospital and who were in relationships who were able again to get health care. So that was really more, I'm not sure that had a lot of political advantage. It might have had it in Coyote County, but not maybe statewide. But that was where the hospital kind of stepped up and did that. So then I came back. So I'm a boomeranger to Community Solutions. I left I've been gone for like 7 or 8 years. And John Bagala, who's my predecessor, said he was going to retire. So I was like, finally, I've been waiting for you to do that. And so I applied and got hired, we're not a perfect organization, but I really love working there because there are not many places where you work, where you have this ability to kind of look at things from a bigger lens. You're not like a single agency having to worry about a line item, program, funding reimbursement. You get to look at the big picture. And so that was a good thing. And the other thing I did was I sort of said, and this was sort of like my faulty reasoning at the time. I was like, well, now that the Affordable Care Act is largely settled, we'll work on Medicaid issues and we'll try to look at ways to kind of improve Medicaid. Things we had ideas about. Of course, in 2016, Donald Trump would get elected and try to repeal the Affordable Care Act, which we were part of helping defeat. But I mean, during my time there, we did a lot of successful policy stuff with the Kasich administration and the DeWine administration. It was also during this time I had another one of those sort of prophetic moments. At the time, there was a push, not by the Kasich administration, but by some of the legislature, and this is still there, to implement work requirements for Medicaid. And it's just a bad idea. Like the state of Georgia put these work requirements in recently for their new Medicaid expansion. 90 cents out of every dollar they spend goes to administrative costs. Only 10 cents to healthcare. I'm like, that's crazy. Just endless money to waste. So we would really regularly speak out about why work requirements were a bad idea. And that didn't always win us a lot of friends with some people in the legislature, whatever, but we just felt like we don't see any gain to this. And there's been so many positives that have come from expansion, particularly around behavioral health, the opioid issue and things like that, that were really sort of Medicaid expansion was making a difference. But we got to do, lots of stuff with lots of different agencies. Also, I was, my first nomination to a state panel on the Advisory Council of Aging came from Governor Kasich and then Governor DeWine, and appointed by two Republican governors. Never got appointed by Democrats. And so a lot of good things. Other thing I'm really happy about was one of the things there was an option for states for the SNAP program, that if you were age blind disabled, you could go to a 3-year certification period in a way. And Ohio was still at 1 year. And I'm like, yeah, if you're age blind disabled 1 year, you're probably still going to be age blind disabled the next year, the year after that. So the federal government allowed you to go up to 3 years. We got that through the legislature. And so in Canada, it's like 30,000 people were much more likely to keep their SNAP benefits, which is a big deal. The other thing I think I worked on was building a board of directors that was more racially and politically diverse. I think that is so important. Like, that's one of the things I'm proud of that I worked on at Community Solutions, was building a more racially and diverse staff too. In terms of our organization, it was largely white when I got there, and by the time I left, we were like 60-40, 60%, 40% non-white, 60% white. So we were more reflective of the community that we lived in and that we worked with. But to me, that's also really important. And the political part is too. And we hired people who were Republicans. People who think us. It's just, I remember we had, I don't know if you remember Bree, who was on our staff, who went then to work for Milano. I said, can you put this in Republican speak for me? Tell me how to say this in a different way, or how I make it. I just think that's really helpful to do that. Be open to those things. So here's the things. So the things I think about, sort of my learnings from this work. One, I think data is really important. It's not the end all be all of these conversations or these issues, but you have to understand it. And so that's what we spend a lot of time, is trying to make that data available to political leaders, but also to organizations and individuals. In fact, when we would do these profiles of state legislative districts, I would say, don't look at your district, look at your colleagues' district, because you'll understand them better if you look at who's in their district. And there are some pretty significant differences around different issues. Collaboration, don't go it alone. I was much, when I started, I was more of a go it alone guy, and I became much more of a collaborator. And also, if you can reach consensus on policy, it's going to be more long lasting, because if it's just one side that is going to push it through, it's more likely to be undone on the other side. So the more that you can build consensus and collaboration, I think is a positive thing. I think community voice is essential to this. understanding how these things actually work for real people. Here, I would always say, I know what the law says, tell me how it really works. How do these programs really work, in community? Diversity, I talked about that. Your team or organization should be as diverse as your community. Expertise, I always say I love working with smart people. And I've worked with some really smart people at Community Solutions, particularly the Department of Medicaid, really smart people. Other places so you want people who know their stuff, understand an issue. And then the other thing I always talk about is relationships. I'd ask people like, well, who do you have a relationship? Who are the people that you sort of hang out with or know or whatever? Because I don't want all the same. We don't all five of us don't want to have relationships with the same person. We want to have relationships with 500 people, so that those are people we can pull in when we need to around different issues. And then I think the last thing is the pragmatism. Develop practical solutions that are both bold and sustainable. Pragmatic doesn't mean you have to be weak or timid. You can still be bold about it, but you want to look for things that can actually be actionable and get carried out. As I talked before about when I was Medicaid director and discovered the value of IT. When I was at my first staff meeting, Medicaid staff meeting, I said, every advocate should have to come to the state government and try and put it to implement, something they've advocated for, and they're all like, yeah. So that's all I have. But I don't know if people have questions or if we have any questions online or whatever.
John, I got one for you. I've been very curious ever since decided that MCOs would be money back around social determinants. Because I'm a big skeptic, generally, even though I teach it. So
the best.
So I guess my question is, with all your experience in work that you've done, where do you see the pain points and what potential, if any, that this is actually going to pay up? Where they're sort of kicking some of the money back into the governance. I know Southeast Ohio is in one around. Is this just again old wine in new bottles, chasing dragons, or is it?
I don't think so. I mean, that's So we got involved in that. Center for Community Solutions got involved in that process at the very beginning. Because we knew they wanted to take a new look at how managed care was delivering Medicaid program in Ohio. And so we talked to them a lot about here are ways to think about redesigning it. More accountability, more of a two-way street between communities and Medicaid, because it's such a significant program that has such impact across many areas in the community around many issues. And so we actually pushed this idea of the community reinvestment. So this is something that we push, and we've worked with them and sort of implemented it. And I think, I know Director Corcoran is sort of very committed to this idea. She always talked about, we want to be interested in the business of people, not the business of managed care. And so I think that is what they've tried to do. And I think I feel pretty positive about it. Now, having said that, we're going to go through a transition to a new governor. And so that's something to pay attention to as we make that transition. Once Governor DeWine's term is done and we elect a new governor in Ohio, that's often a time when these things can kind of slip. So the farther along we get and kind of institutionalizing it, the better it'll stick. But Rose Freck was one of people who worked with us on it down here. But I think it's been a really authentic process, and the department was really interested in hearing from individuals with that sort of lived experience, that community voice. So they really sort of pushed that kind of plans and us to make sure that we incorporate it.
So, thank you.
Yeah, you.
Oh, I just, I guess to thank Jeff and, to thank us for bringing you in. You've been a hero of mine for a long time from the work that you've done.
Oh, thank you. I appreciate that. That's very nice.
I have one from the chat for
Okay.
you. So Faith is asking, saying and then asking, I liked the pragmatism and prophetic mantra, very evocative. On the pragmatic side, what prophecy can you make about one or two major health advances that could markedly move the needle on healthcare across access currently access across currently underserved sectors? Great question.
Well, so I guess I think about it this way. So I always give the example that when I was in Medicaid director those 2 years, I think it's pretty accurate to say that no one ever came to me and said social determinants of health. It, like, I always say that, if I had wanted to reduce Medicaid spending, I should have walked downstairs, taken the steps downstairs to talk to the woman who ran the SNAP program in Ohio and asked her, how can I get more SNAP benefits into the hands of older people? Because I now know that even small increases in food aid to older adults reduce their use of hospital stays, emergency rooms, shorter stays in skilled nursing facilities. So I could have saved the Medicaid program money by going downstairs, but I don't think that wasn't in anybody's consciousness. And I also have to say that I had a pretty narrow view. I didn't have a very broad view about Medicaid because remember, I'm running this program, at a time when the state is hemorrhaging dollars because of the Great Recession. So I was always very suspicious of anybody who wanted to spend Medicaid money because I viewed myself as very much sort of protecting the taxpayer. Like lots of people had ideas about how to use it. But so I think that was like a learning for me. So I think that social determinants piece. Now I think we have to be careful now that it doesn't go too far the other way, because I don't want to medicalize everything. Because if we medicalize food aid or housing assistance, transportation, it'll cost 3 times as much. And I think the other piece is trying to figure out how do we get money out of these large institutions and into the community. I mean, that's that's why this sort of reinvestment piece is so interesting to me. I mean, it's really a fraction of what gets spent in these large institutions, but I think you probably all heard this sort of statistic that 80% of your health is based on what happens in the community. Only 20% is inside that hospital or that doctor's office. So I think that's is how do we get the money out of these sort of big institutions and into public health, where it might have more greater impact. So, yeah.
Getting the money from the big institutions out. Do you find any opportunities for that we should be jumping on in order to enable that?
I mean, I think generally, and this may be more Cleveland specific. I don't know funders as well around the rest of the state, but at least in the Cleveland area, almost all the major funders are big funders of advocacy and sort of community organizing and action and stuff like that. So I think that's one thing to think about is, are there funders out there who support organizing and advocacy around these issues? Because I think that was the, and that's changed over time. From the time I've been involved in this work, more funders have come to that conclusion. And I think you see that in other funders around the state because, if you want to have leverage, you've got to figure out how to do it bigger. How do you bring it to scale? How do you work rather than working at the sort of micro level? How do you work at the macro level of the system? So I think that's one thing. I'd also talk. A lot of these, insurance companies have big foundations here in Ohio that they fund stuff like this. It's always, if you can find those things where people's interests line up. I think what I talked before about the ADAP, the HIV drug assistance program. I could get the drug companies, the advocates. We had a similar interest, and so we used their political connections, our personal connections, to kind of persuade the legislature to move on that. So I think looking for those partnerships, maybe where people's interests might align. And they don't have to align entirely, but maybe they align a little bit, so you can find some overlap.
Some questions in the chat too. I'll take one, and then I just want to remind folks to raise your voices when you're speaking so that folks on the line can hear. We have one that's come in from Lauren Craig. Can you speak on the recent drop in Medicaid insured individuals and how Ohio plans to combat this?
Yeah, that's a really interesting question. So that was one of the, so that's the whole issue around redeterminations. During COVID, those were suspended. The state couldn't take action. So we had lots of people who hadn't been sort of had any contact with the program or a caseworker for a long period of time. And so, I mean, I think Ohio is going to have a large number in sort of overall numbers of people drop off because we have a large program or a large state. And unfortunately, it's a lot of kids, and that's really the downside of this. But I think the state actually did a pretty good job. There's a process in Medicaid called ex parte determination. What that means basically, I sort of describe it simply as this. The state has lots of information about all of us from various programs or whatever. And so the idea was that the state should use the information it already has in its possession to determine eligibility. So if they know already that you earn enough money, a small enough amount of money, you qualify for Medicaid, they should just use that to act on your application, not require you to fill out a new form or re-sign up or whatever. Just do it automatically. You know what your circumstances are based on the information you have. So before the great unwinding, Ohio did that in only 5% of cases. They were able, through the use of technology and bots, up to 50%. They were able to, so 50% of people whose Medicaid might otherwise have been lost were, sort of automatically signed up again without having to take any action. But that still meant there were others that weren't. And so that's been, I think, the rub is how do we get those people on? And one of the big issues was really around kids, because it got tricky, because a parent might lose their eligibility, but a kid would still have it because the income levels for kids are higher. There's no way to increase the system in the country about all these different eligibility levels. But the kids goes up to 200. The other thing that the state has done that they got through the legislature that will help going forward is they have created what we call continuous eligibility for young children up till the time they turn age 4. So when a child's born, if they're on Medicaid, they maintain their Medicaid coverage all the way up to the age of 4. Before it was you had to get redetermined every year. So that should help as well going forward. So I think those are the things they're trying to do to help address that issue.
I wanted to ask you about what you think makes a good partner, and narrow that a little bit because we're sitting at the point of a school that prides itself on making partnerships to make a difference in the state and the region. And so perhaps in answering what makes a good partner, if you could reflect on times you have or reasons you haven't partnered with universities that share a topical and kind of policy progress objectives and goals.
Well, I mean, at Community Solutions, we definitely partnered with universities. We had partners at Cleveland State, Case Western Reserve, the Mandel School of Applied Social Sciences. They operate a poverty center, and so we worked a lot with them because we often looked to them for the data and research. During my first stint at Community Solutions was when welfare reform took place, when President Carter signed the welfare reform law. So yeah, we've always had sort of those university partners. Part of figuring out your partners is trying to figure out what you want to get done. And I always like to think of, okay, what do I want to get done, and who has the power to do it? Who can actually act on it? And it's usually not a long list. Most issues are decided by 3, 4, 5, 6 people, whether the governor, the speaker, the Senate president, or whatever. So how am I going to get whoever I need to sort of influence on this? Maybe it's just one person sometimes. And how do I get to be a partner with them? So a good example of that was when Bob Taft was governor, and during that another economic downturn. See that a lot. But they had put in place a temporary penny sales tax, and we were trying to get it preserved because if it took it away, it's going to cause all these cuts throughout state government. So one of the things we did was we put together a report that showed, okay, if you take that penny out, here's how much revenue is lost in state government. We're going to just take that share out of every state line item in the budget to show everybody, this is the cut you might see in higher education, or this is the cut you might see in senior adult services. And it got, people hadn't done that before, and it was pretty simple actually. But that was when we put that out, that is my first and only time, I think, that I had a state office holder issue a press release denouncing over. was like, yay! I still have that press release. But I was like, oh, good, we got their attention. But, and so in that instance, we were partnering with Governor Taft on that, because he was sort of our ally in maintaining it, because he was governor at the time, knew, what reductions would be required and stuff like that. So, in fact, we did polling, we did public opinion polling, we went, presented it to the governor, and in that same poll, it showed how unpopular it was, and it was like, we're trying to like get over that page really quick or whatever, but he laughed, he thought that was funny. But I think you have to be open to any partners. Like, again, I don't think you can, I mean, I suppose there's some that you would never want to partner with. Like, I don't know that I want to partner with us, for example. But I think you have to be pretty broad about it. And particularly people of different political views and stuff like, because that makes you stronger, because you then have more relationships with people you can talk with.
John, I realize we are just past
Yeah.
time a little bit, but
Yeah.
if you're not in a rush, I have one more question in the chat. That's okay.
Okay.
Well, first, there's a comment. I'm not sure the full name, but last name Sigmund. Says just Ohio is a better place because of your leadership. So thank you. I respect your interest in collaborating with all. How important is timing and anticipating challenges in leadership? Ask more pointedly, should advocates wait to push initiatives until the new folks are in place?
I'll never wait. I'll never wait. I mean, this is right now is like the best time to be talking to people because it's an election year. I mean, when do elected officials want to talk to voters and people? It's in election years. It's the best time. And I think the smart people right now would be looking, and we've done this kind of work before when I was at Community Solutions. The first time, looking ahead to the government, we started out maybe a couple of years from the governor's race and said, okay, who's going to run? Okay, we're going to get to know all those people. We're going to get to know the people that are working on their communities. We're going to start feeding them our information, not knowing whether they've adopted all or supported all, but we want them to be familiar, and we want to be familiar with them so that if we do get elected, we don't meet them for the first time in January, when they all show up here and they're a little dazed and confused by everything going on. Yeah, now's the perfect time. And the other thing I always think is important is write out a plan. Put together a written plan about how you want to proceed, because that way it's easy for things to kind of slip. And if you sort of try strategies, but yeah, don't wait.
One last one, and I think it'll be a quick one because I think the answer is yes. I'm going to answer for you. So what Trudy is asking in the chat, do you think your start at OU played a role in shaping your goal of working with underserved communities, or was this present before starting at OU?
Oh yeah. I mean, I think going to OU has left me with a soft spot for Southeast Ohio, because I was aware of the great poverty that was here. Didn't have to travel far out of town to sort of see that and experience. So I think it also, I think, made me more, I think sometimes in cities we tend to dismiss people in rural areas because we think, oh, what do they know? They don't know anything. But I think if you go to school someplace like this, you realize that's not true. And there's a lot to learn, even for those of us in big cities.
Awesome. Well, thank you so much.